society the need for partnership, and it's a great pleasure to introduce Dr. Mary Baker, President of the European Brain Council. She's also President of the European Federation of Neurological Associations, consultant to the World Health Organization, and Chair of the World Health Organization Working Group on Parkinson's Disease. Mary retired as Chief Executive of the Parkinson's Disease Society in 2001, where she had worked for 18 years. In 2009, Mary received the British Neuroscience Association Award for outstanding contribution to British neuroscience and for public service, and she's also an MBE, and it's a great pleasure for us to welcome you here and to listen to what you have to say, Mary. Thank you very much.
Thank you very much for that kind introduction. May I say I'm delighted and indeed honoured to be here. Thank you very much. Well, I'm sure many of you in this hall will know the marvellous work that the World Health Organization has undertaken in the communicable diseases, malaria, polio, tuberculosis, smallpox, to name but a few. But increasingly, they have become interested in the non-communicable diseases. And in 2005, they called us to Geneva to ask us to look at 5 diseases: Alzheimer's, Parkinson's, multiple sclerosis, headache, and epilepsy. And we wrote the chapters, well, certainly the neurologists and all their band wrote excellent chapters, and in 2007 it was launched in the European Parliament to a host of journalists. And at the end of the presentation, one of the journalists asked Dr. Saraceno, "Is there anything there that surprises you?" And he said, "Oh yes, the trajectory on the brain diseases. If they continue this way, they will overtake cancer, and they will eventually overtake cardiovascular. This will be a very major challenge." The European Brain Council, which I'm very proud to be a president of, studies showed that already that 127 million Europeans suffer from a brain disorder. The cost is enormous, and in October we launched the update to that study, where I'm already apprised that the figures are going to be even more dramatic. Now, just to give you an illustration from the chapter that I was involved with on Parkinson's disease, this was the very first time that the World Health had started to measure beyond what was easily measurable, i.e. the cost of inpatients, the cost of the outpatients, and the cost of the medication that they receive. But now, for the first time, they recognized the uncompensated care of the families. And for the very first time, the loss of productivity to a nation. And as you can see on this one on Parkinson's disease, the loss is high. And contained in the productivity will be the presentivity, the people who are still working but are slowing down the rest of the workforce. So these illnesses are increasing and are very expensive. Now, I think all of us in this hall are very privileged. In our lifetime, we just might have witnessed mankind's greatest achievement, which is the ability to stay on this planet for a very long time. In the last 100 years, we've almost doubled the time man can live on this planet. At the beginning of the last century, a man born in London had 42 years expectation of life. It's now nearly 80, and for the women, it is over 80. And if we go further afield to this little girl, born in Japan, she has a 50-50 chance of living to be 100 years of age. What an achievement. But like many achievements, there is always challenge. And the challenge is, as a fact, that the longer we live, there will be more brain disease, more Alzheimer's, more stroke, more Parkinson's. And these illnesses, if they are badly managed, cause terrible distress. And if they're badly managed, they run away with the health system's cost, which no country in Europe can possibly afford. But there's also something else going on. and that's the changing role of women. If we go back 100 years, there were terrible wars fought in Europe, millions of men died, and many women did not find enough men to marry. And so in the structure of the family were those unmarried women, those unmarried cousins, those unmarried aunts. And when people were taken ill in the families, they gave care, and that care was freely given. Today, it is totally different. We have a falling birth rate right across Europe, and we have wonderful career opportunities for women, which is absolutely great, but the structure of the families has entirely changed. As you can see, in the 1920s, a couple already in their 80s have 44 female relatives alive and 14 of them not doing anything else but working in the home. And in the year 2000, a couple only in their 70s have only 13 female relatives alive and only 3 of them not working outside of their home. And we're now waiting for the situation to see what it'll be in 2011. So that's quite a challenge. The longer we live, the more illnesses we accumulate. And I have to tell all of you younger people in the audience that you have to be prepared, because once you're 60, you will have at least 3 illnesses moving on you. And just remember what Rosenberg said. It's quite a thought, isn't it? What Rosenberg said, good health is merely an incomplete diagnosis. So you have the challenge of polypharmacy and the challenge of comorbidity. This is a different world. And I was looking at the BMJ just this week, where they're already showing, there is evidence showing, that with polypharmacy, it does affect your physical health and your cognitive skills. So there's a very big challenge there. This is the shape of the world to come. It's an aging population. And I think one of the statistics, and I noticed somebody from Swansea, I wonder what they have to say about this, that just perhaps 2/3 of the population who've ever been on this planet, who've reached the age of 65, are on it now. It is an amazing challenge. We've got migration moving across Europe as we've never seen the like of before. And this gives us major challenges to our societies and to our health systems. People arrive from all over the place, and they have to take what is on offer. Sometimes that's appropriate, but sometimes it's not. And again, it causes distress, and it wastes money. Time with a doctor now, 12 minutes. 12 minutes to describe some of the complications of these very challenging illnesses. Access to medication across Europe is very uneven playing field. Some countries have the whole range of medication and reimbursement. Others have the range of medication, no reimbursement. And some countries have absolutely nothing. And then just to spice it all up, we have this increasing threat of the counterfeits. And they feel now that there's probably, on an estimate globally, that 2,000 people die every day because of the counterfeits. I'd just like to show you this lovely picture here of the manufacture of medication, Colombia style. And I think you can see the cement mixers and what has been found in the medication. These are clever people who are doing this, doctors, pharmacists, and ex-employees of pharmaceutical industry. They're not fools, and this is becoming a grievous threat. Why aren't we doing more about prevention? We're a society that always expects a quick fix. You should see the pressure on the industry to provide a pill that will contain in it aspirins, statins, just one pill, pop it all in, and you get over all the symptoms that are challenging in your head. Why aren't we doing more about the healthy lifestyle? Why aren't we doing more about perhaps looking at the effect of natural remedies and trying to get more responsibility into the families to manage health? It's always been troublesome and challenging at the European Medicines Agency, where they're faced with safety versus innovation. Too much safety stifles innovation. And I thought I'd put up this quote from a good friend of mine, Albert Jovel, a doctor, age 47, living with metastatic cancer. I'm already in an unsafe world. A little more unsafeness doesn't worry me. They very much want to be involved in conversations and debates as to what is acceptable risk and what is not. So this is a really important debate that we should be furthering with society. We need to improve the trust and transparency of our great pharmaceutical industry. There's tremendous suspicion, and of course the previous speakers mentioned the problem or challenge of the media. And of course once the pharmaceutical industry is in the media, of course that's usually leads on to major headlines. And we've got to ask the industry to come up very upfront. Who's more important to them now? Their shareholders or the society that they should be serving? It's a big challenge for everybody to improve the trust and transparency. A new approach of clinical trials is needed in our ageing population. So many times there are such strict exclusion zones. The people are too old. But that is our population now. How do we manage a new approach to the clinical trials? They're 50 years old now. They're almost out of date. Patient-reported outcomes. How can we get much more involvement from the patients who can share in an intelligent fashion what is really mattering to them in the management of their illness? And this is particularly, we're looking at a really good partnership with academia, the clinicians, the patients and their families, because this is something we have got to try to provide for the EMA, the European Medicines Agency, and the FDA, that when the medications come up in front of them, yes, they've got the hard evidence of clinical trials, but they've also got, far more importantly, the actual responses from the patients as to what has made a difference to their quality of life. And we're actually working with Oxford to try to get this to move ahead. And then, of course, is the challenge of the regulator and the payer. And Guido Rassi has just been elected as to follow Thomas Lerngren now as the head of the European Medicines Agency, a pharmacist. And, of course, Mike Rawlins, who's done such an outstanding job at NICE. I always remember every time I go to see Mike Rawlins, he always gives me this lecture. And I think it's important to share it with you, that for our country, the United Kingdom, 60% of our NH budget is spent on lifestyle. We are an ageing population. We are an infertile population. We have the worst sexual health right across Europe, more teenage pregnancies than any other country. We're still smoking. We're still taking the drugs. We've now increased our consumption of alcohol, and just to add to everything, we're now getting obese. And all of that has taken 60% of the NHS budget. The patient advocacy groups are well and strong, but they now have extra tasks to try to make the dialogue between the payer and the regulator in an understandable new sort of language to them. They have to work hard to establish their credibility and, as you see, collect evidence. But most of all, they have to understand this new science of health technology assessment. Distress is no longer enough. When I look back on my job description when I first went to the Parkinsons Disease Society, I was then their welfare director. And my whole job description was about telling everybody how terrible Parkinson's is. But now, when I'm at the Commission and talking about brain disease, I always dismiss it in a couple of sentences. I'm sure all of you are aware of the distress of these illnesses. What is needed is this new language, the statistics, the trajectories, the costs, because that is what is mattering more and more. So we have to help the new patient groups to absorb this new language in this new world. And we've set up a summer school with the London School of Economics, where we bring them in to understand the cost and why they have to take this new approach, and to give them the language of negotiation. The patient's journey. Look back on your own lives. All of our lives are a journey, and a journey that we've been prepared for by our parents, our schooling, the books that we read, spiritual values, the people we meet along life's journey. But there's a part of that journey that nobody's prepared you for, and that's the moment that you receive the diagnosis of a long-term serious illness. Nobody prepared you for that. And when we talk to the people and ask them what it is, they sum it up very succinctly. It's the loss of control over your life. Do you know, I don't think any of us understand what that is until we've lost it. So how can we help put back control into people's lives? They want information. They want a map for this journey. Just as when I came here, I was sent a very helpful map to find the Windsor building. I didn't want to have to do tours and tours around the campus before I got here. We do need maps for our lives. So they need to talk to clinicians who can truly listen and understand and explain. They need to understand the medication that they've got to be taking. And they need not to be prevented or pushed away from the pharmaceutical industry. They need to talk to the industry to understand the medicines, and who knows better than the people who produce them. And they need to talk to the fellow travellers who belong to the, who've got these illnesses. I'm sure if some of you wanted to take off to go to Beijing, yes, you'd go and get your ticket, but it's nice to talk to people who have been, come back, can share experiences. That's really important. And yet, what we've got at the moment is how they access their medicine. Let me show you how long it takes now. I used to be able to say, when we get the medication from the bench to the bedside, it used to be quite a phrase. Look at it now. The preclinical development for any of the medications in the pharmaceutical industry is about 8 years. They then negotiate with the Medicines Agency, who may tell them that their clinical trials are too narrow because of the exclusion. They need to be widened. They're sent back. More time, more expense. Usually 2 years to get past EMA. The payers then say, well, all this increase of money, it's too much. There needs to be another negotiation for health technology assessment. And that takes another 2 years. And then finally, when it reaches the clinician, usually he says, let's wait a little bit till we get some more results in. It would be more helpful if I had more data. And that is another year. In our aging population, we're asking them now to wait 13 years for medication to manage them to adjust to living with long-term chronic diseases. The Holy Grail always had been pursued by most of the patient groups as the cure. Find the cure. And indeed, that has always been based on everything that you're marvellous at. First-class scientific culture, rigorous methodology. What a fine list. Honesty, integrity, objectivity, transparency, ethics. Wonderful. But what about the competition? Competition in the pharmaceutical industry is terrible. Yes, it's understandable in the marketplace where they have drug to drug, but they do not share. And we're losing time because they do not share. Clinicians pursue competition. Their papers they have to write in the journals. They guard their academic territory. But most of all, the patients. Parkinson's is more important than MS. No, Alzheimer's is more important. The competition has driven us, and it has not resulted in the best way forward. Science should be shared. And if I may add, science should be responding to the needs of its society. Moving forward, it's a time for change. And this is where we really need your help so much. We need multidisciplinary partnerships. This is a grand challenge now of society. It requires cooperation at the highest level. It means creating high-performing networks. And we in the Brain Council have really tried to follow that. And what we're working towards is 2014 to be the year of the brain. Not because we think brain is more important than cancer or more important than cardiovascular. It is because the brain is the unique organ that manages the management of these illnesses. It is an incredible organ which needs to have a high-profile awareness. In the European Brain Council, of course we want to promote knowledge of how the brain works through education, science, research, environment, sport, yes, even those gold medals that will be won at the Olympics. It won't just be those muscles and that training. It'll also be the brain thinking the moment to move forward. In art and culture. And we want to maintain and improve productivity and intelligence. And we want to celebrate the wonder of the brain. Working with others, we want to involve a variety of stakeholders, not the old, just the neurologists and psychiatrists and neuroscientists. We want to widen this to all sorts of stakeholders. We want to work with the national implementation bodies and to agree themes at the national level that will really inspire the countries to take this ahead with the key stakeholders. And of course, anything that you're going to put all this energy and all this money into, we want to look at the legacy. Yes, we want to see the brain research budgets increased by 50%. We want to reduce the stigma of mental health. It's been with us for centuries, and we understand it a little better, but we don't do very much about it. We want to increase the proportion of our children to wear their helmets to protect them if they have an accident, and to encourage all mothers to understand nutrition better so that the moment their children are born, that they're on a better diet. We want to raise society's understanding of the importance of blood pressure to reduce the onset of stroke. We must try to decrease the number of strokes. You know, every time someone has a stroke, a third will die, a third will live with severe disability, and a third will get back to normality. And the cost of this illness on health services is tremendous. And they go on for such a long time that we really must try to do something about this. To increase the awareness of brain health in general, not in a competitive way, but showing how this organ is such an important part of managing our activities. So what we want to, of course, influence the policymakers, which is always very hard. And I would have loved to have challenged Alan Milburn to that, because often government policies are very short-term, where this is a long-term project. It's got to go beyond their usual 5-term. And of course we want to measure the impact that we're proposing. There's an extensive research programme before and after. But what I want to really leave with you is the challenge for the future. The holy grail of the cures is passing. Of course we always want that to happen, if and when. But for the majority of us, we won't see the cures of some of these illnesses. What we've got to do is to help society manage better and to have the ability to adapt to living with an illness, which you're now going to manage in a better way. And the whole way of trying to do that is to participate in society. It would be a totally new thing to just try to adapt, to participate in all the social activity of your lives, despite the limitations. And I want to end with this quotation from a man I really admire. It's not the strongest of the species that survives, nor the most intelligent. It's the one that can adapt to change. I hope you'll help us change. Thank you very much.